Hi, this is Clint Wheelock with Informatech, and I'm here at Techcelerate London, which is home of the AI Summit, IoT World, 5G World, and many other co-located events that really bring together the who's who of the technology industry here as part of London Tech Week. And I'm joined today by Mark Beccue, who is Principal Analyst with Tractica, focused on AI and related areas. And Mark has just spent really the entire day chairing the AI Healthcare Summit that's part of the broader AI Summit here. And we know that healthcare is one of the most promising areas in terms of AI use cases and applications. And I would have loved to have sat in the room and listened to the current state of everything, but was busy with other things. But fortunately, Mark is here to give us the download in 5 minutes or less of what's new in the world of AI healthcare. And so let's just kind of start off and say, how would you assess the state of maturity or the level of adoption within the healthcare industry? Is this a case where AI is still the subject of pilot projects and trials, or are we starting to enter a phase of commercialization?
Well, it's kind of a mixed bag. You know, if you think about it, there are certain pieces that are a little more mature than others. So the pharma people are using AI to do predictive pieces. So they've got more data that they can work with. It seemed like that's moving along. There was discussion about that. But as you know, there's so many issues that can be in healthcare that can be kind of addressed by what AI can do in scale. You know, there's this massive idea of scale, and you kind of look at the drivers around what's going on there. So you have these varying degrees of maturity. The toughest ones are going to be how do you scale healthcare workers, right? That's at the early age. So you've got the more mature is pharma, a little bit more mature, and then the less mature would be how do we scale healthcare workers? How do we scale onboarding? You know, things like that, which are much more complicated because there's more players in the space that have to be brought in.
If I take a step back, and that's really interesting as a starting point, just kind of knowing that it's a mixed bag. And after all, Tractica's assessment and our market sizing and forecasts in the AI healthcare space encompass at least 15 to 20 different discrete use cases. So that's not surprising to hear that they're in varying states of maturity. But I'm curious from what you heard, Mark, in the discussions today, and I think you introduced and worked with something like 15 different speakers from across the spectrum of the industry. If you had to classify the key applications you're looking at, one thing that strikes me is that the healthcare industry is unique because it's a very data-intensive industry on the one hand, and on the other hand, it's an industry that has a tremendous amount of unstructured data that doesn't necessarily lend itself to the algorithms that have really made AI a household word over the past 5 to 8 years.
Right.
So as you heard about the different applications, how much of the ones that are starting to get scale are based on structured data that needs to be cleaned and classified and tagged versus unstructured data that might be benefited by advancements in natural language processing or computer vision or what have you?
Yeah, so there really was three stuck out for me. There were three, and I think it had to do with the vision of those organizations being how they organize. So how much they can control. And I'll give you three examples. The first one was the Cleveland Clinic. And Cleveland Clinic is a healthcare organization that has a vision. Their drivers are a little different. You know, they're a nonprofit. They incent differently to the people that are there. And they had this vision for a while about collecting all this data. And so they've digitized themselves, which makes it easier. So if you think about what they're going to do, it's different than some other healthcare organizations, which maybe are bigger or whatever, but their idea was, how do we digitize all the data so now we can feed it into things and start to do things that make sense with AI. So very innovative, had everybody sitting up. I'd never heard anything like it. It was really interesting.
You said there were a couple other interesting examples as well, along with Cleveland Clinic?
Yes, so the other two were the NHS, which is here in the UK, It's divided into different groups, but there was a part of NHS that has adopted using Microsoft tools and this incredible platform to take down the work of the back office in a way. So, onboarding, getting people up for appointments, working through all the kind of the details of taking care of customers, let's call it. And it was really amazing to hear what they were able to do. I was a little skeptical. I was like, wow, you can do all these things. But they've scaled up quickly, and they're not using data scientists. So that's a really interesting thing about the idea around where we are in the market. So that if you can use a Microsoft tools that don't require a data scientist, it's pretty interesting. It would make you see that that's kind of mature. And then the third one was a company called Hive, which is based here. It was working with a company called Carers UK. And the vision of this was allowing people who are caregivers to, let's say, senior people, to work more efficiently. So they're basically using Hive to put sensors in the home, using AI to understand movement, understand patterns, so that they can say, here's what's going on now. So that gets reported on an app to the caregiver, which cuts down on the amount of time they have to do certain things. And they're just at the front end of this. That one's really interesting as well. I think we're going to see a lot of things go towards how you keep people to age in place, how you preventative healthcare, those kinds of things. So you can see they're all a little different and different drivers for each.
Well, all I can say is, wow, I mean, great examples, and I have a feeling that it's really just scratching the surface of some of the applications that are being explored, knowing that that's an innovative market, and of course, AI is the boundaries are being tested in all kinds of different industries. So thanks for sharing your initial impressions, and maybe we'll have to check back tomorrow and see what else is new on day 2 of the AI Summit.
Sounds good.
All right, thank you.